Welcome, everyone, to another episode of Interpreting for Healthcare. It's the monthly podcast sponsored by the National Council on Interpreting for Healthcare and produced by the Standards and Training Committee. This podcast is intended for you, our members, as well as the public at large and everyone working to promote language access and social justice. Joining us today are two very special guests. The first guest is Esther Monzo. She's an associate professor in translation and interpreting studies at Universitat Jaume I in Spain, where she coordinates the TRAP lab on translation and post-monolingualism, helping make societies aware of how monolingual ideas are boycotting our ability to cooperate across languages. Prior to that, she was a translator and reviser for the UN system and a full professor in the sociology of translation and interpreting in Graz, Austria. Currently, Esther is involved in conducting research in the area of language rights, the uses of translation and interpreting in managing diversity, and this includes an emphasis on gendered language and technologies. She's also an activist for language rights. Esther works with the chair of language rights, University of Valencia, Spain, and is preparing an edited book on gendered technology, law, and translation, along with a special issue on gender and ethno-linguistic lawfare for JUST, Journal of Language Rights and Minorities. So welcome, Esther. I can't wait to dive in.
Thank you so much.
And before we dive in, I want to introduce our next guest, Amy Olen, who is an assistant professor of translation and interpreting studies at the University of Wisconsin-Milwaukee, where my mentor at Brown did his graduate degree. She has a PhD in Spanish and Portuguese from the University of Texas at Austin and master's degrees in translation studies in Spanish and Portuguese from the University of Wisconsin-Milwaukee. Amy translates Latin American literature and is a contributing translator with the journal Latin American Literature Today. She's been a Spanish, English, medical, and community interpreter since 2005, with experience as a hospital staff interpreter and freelance contract interpreter. She's part of an interdisciplinary team of researchers studying medical interpreting and language access in pediatric medical settings. Those are particularly tough and the ones I can never say no to, even though I've semi-retired this year and the trip all the way to Seattle Children's is about 60 plus miles, but if they call, I'll go. So welcome, Amy. Welcome, Esther. Let's get started. I'm so glad you're here with us today. So looking back, what would you say either makes you most proud or had the most impact in setting you on this journey for language access, translation, interpreting, etc.? Amy, I'll start with you.
Okay, thanks. Sounds good. Thank you so much for having us. It's so fun to be here with both of you today. Spend a little bit of time chatting about all the stuff that we all love so much in terms of language access and equity for language diverse populations. So my pathway into doing research on language access really stems from my experience as a medical interpreter, but also as a collaborator, research collaborator. And so one of the things that I'm really proud of is being part of a collaborative team of researchers that includes academic physicians, nurses, nurse practitioners who work in a local pediatric hospital, and then also pediatric psychologists who are academics, but also practitioners and also work in a certain pediatric hospital here in Milwaukee. And it's been wonderful to be able to participate in that interdisciplinary group of researchers as kind of the sole interpreter. And to develop a project that interviews interpreters about their experiences, working in pediatric settings in particular, which are are, as you said, tricky, challenging, and sort of thinking through how do interpreters communicate distress? How do they manage that distress that they're experiencing from families and patients? How do they cope with it themselves? So we were able to develop a project that really asked them about their experience in this way. And we interviewed 13 Spanish English medical interpreters, and were able to produce some manuscripts about them, and one of which was published with Just, which we're really proud of. And I think the thing that my co sort of lead researcher, Paulina Lim, and I are probably the most proud of is just having heard interpreters say to us, thank you for asking our opinion. Thank you for, inviting us to talk about our experiences, because they are hard. And let me share with you all of this knowledge we have and all of this expertise that we have. So that personally, as an interpreter, I was super proud of that. To hear them say, thank you. We're super excited to share our experience. I think the other thing that I'm kind of proud of with that research work is having created connections with language service management at the Children's Hospital where we did our work, because we worked specifically with a sort of a dynamo named Kristen Nordness, who's involved in the council. And she was really able to help contribute to our research with interpreters, just giving us context about the hospital system. And that was super helpful. And that's a collaboration that I think is going to endure. So yeah, in a nutshell, that.
That's great, because I think when multiple stakeholders are involved with interpreters, that crossing that divide that helps the perception of seeing interpreters as part of the medical team rather than a tool to be used, like an app, really starts with that kind of collaboration. And staff interpreters do have that privileged position of being able to get to know the providers, and the providers being able to get to know them over time, which also helps build a lot of trust. So I'm really glad to see efforts in that direction. Esther, I'm going to direct the same question to you. Looking back, what do you see as something that sticks out that either moved you in a particular direction, or that you are particularly proud of having participated in or initiated? Or it's a pretty wide open question.
I know. I'm quite proud actually of having the experience of having been discriminated against. I know it's quite weird to say that, but it makes you sensitive. It makes you aware of the issues that are impacting people traveling worldwide on different grounds. And being aware of that, so it's the journal Amy mentioned, the Jazz Journal for Language Rights and Minorities, started off a group of people that have cared for changing how society addresses those inequalities caused by people having different languages, different ethnic backgrounds, and meeting in a society which has a very established and dominant language and culture. And so being aware myself of how discrimination impacts people, their well-being and the prospects of how they behave. I'm very proud of having that experience and being able to do something about it, because I must acknowledge my privilege. Now I'm in a position where I can help others who want to contribute to solving that problem. And that's been made possible by this journal, because we are a team of people with this, we share the same interest, and we care about the issues we are studying, the issues that other researchers are studying and want to publish with us. And I think that was very clear in the very first special issue that we published. The title was Language Policies for Social Justice. And it was a very good example of how we have been working in the journal, of how we care for the topics that people, our authors, reviewers, editors And we have a representation of scholars from a variety of disciplines because we agree that's essential. What you both Eliana and Amy mentioned. And we include translation, machine translation also, so and computing and translation together, then interpreting, medicine, legal studies, social work. And the different papers in that first special issue dealt with topics at the macro level, so policymaking and trying to influence policymaking, and at the micro level with interaction, with asking people how they feel when translating, when interpreting, and when being interpreted and translated. And they all, in this special issue, it's interesting that they all reveal the same problem, that translation is misunderstood, is heavily misunderstood, that people believe that translation and interpreting are magic wands that will fix everything, and they don't have to engage themselves in solving the issues that arise when societies are diverse, and they are becoming more and more so. And so this special issue was an attempt to debunk the myths of translation being magic and happening without people or without some kind of organization behind that. So the first one, in this special issue, we start from top and go and move down. So we start addressing policymaking. So stressing the need for policymakers to gain richer knowledge on how translation and interpreting practices are impacting stakeholders. And to take advantage, it's in our nature, in human nature, to care for others. So there are experiments based on game theory that tell us that we have this inequity aversion. It's natural to us. We do not want to treat people poorly, but we need to have some kind of contact with those people in order to know that we are treating them poorly because they have different needs, different expectations. So my colleague Christopher Malingen, who was co-editor of the first special volume, offered kind of the landscape for the other papers to fit in. And then we moved to how governments talk to each other and how they understand translation, and how that misunderstanding of translation, again, magic one, that misunderstanding goes back to the different governments at the national level and is framed within the legal frameworks, the very same misunderstanding, and how everyone expects translation to solve everyone's problems without even being given resources to solve those problems. And that's quite a big problem, but we need to acknowledge that there is that problem in the legal discourse in order to change things, because things we have to be aware of that things go from the people at the policymaking level are deciding how we are treated in their interactions. And then we see how policies during the pandemic were being developed and how machine translation was used as a substitute for human translation, and how that caused misunderstandings for people of a myriad of languages, and how that shows that, again, people do not understand translation, do not understand what human translation should be used for, how machine translation can help, and what machine translation cannot do. They cannot substitute human translators. And it is shown by offering examples of how COVID information was given, offering no actionable information. So people who didn't speak the major languages had to find alternative media as a source of information, and that caused the chaos we saw in the COVID pandemic, simply because we didn't have a language policy that worked. And this paper, it doesn't only call for human translators to be taken into account, to be engaged in those communication enterprises, but also for all the people who are not translators to be trained in at least how to use machine translation. So how you have to change how you write if you want machine translation to work, because machine translation is a simplification of things. So you cannot expect to talk as a human and be translated by a machine correctly. You need a human for that.
There's
so you need
no nuance, is there?
Yeah, exactly. Yeah, and all the intention is missed. Only a human can get your intention. So you really need to be retrained in writing if you want machine translation to work. Then Amy's paper, the focus, sorry, your team's paper, it was a collective effort. The focus was on a particular workplace, and through her paper, we had the perspective of the service providers and the interpreters on why translation and interpreting wasn't working there, because they were not understanding, they were not talking the same languages when thinking about translation and interpreting. And then we have another paper on this one is set in the US. Then we have another paper set in Finland. And what I think we have to take from this paper is that there is a status problem for migrant populations, and that this is conveyed to their interpreters. So interpreters have a status problem because they are interpreting for populations that have a status problem. And that impacts their possibilities to perform professionally. And those interactions have repercussions in the system, and they have an impact on interpreting as a profession. So basically, in this case, the professional that interpreters work with attribute low competence, low agency, low worth to interpreters, because they are attributing the same low competence, agency, and worth to migrant populations. And the way they behave, the way they think interpreting works, the expertise they think it is required for interpreters does not match reality. So again, we have people who need to cooperate, but are talking different languages in terms of thinking about translation. And at the end of the day, what this results in poor services being offered to migrant populations, which is a problem for societies at large, not only for the migrant populations. And then the final paper in this special issue talks to service users, to migrants, and their experiences with interpreters. It's interesting because in Sweden, and now also in Norway, interpreting is not a right that was granted to the migrant populations. It was a right granted to service workers because they have to fulfill their service, their mandate, irrespective of the language of the people they have to serve. And what this paper shows is that service workers do not use that right when they think, well, they will manage, that the migrant populations will understand the basics of what they want to convey. And so they don't use the right to an interpreter. And then the migrant populations self-regulate. They don't want to be a bother. So they don't ask the service worker what they do not understand. Plus, they have had poor experiences with interpreters because interpreting is not being considered a high status service, not only profession, but service. And so it's exactly what you said, Eliana, it's the trust. They don't trust interpreters because they do not, because of the system, not migrant populations themselves, but because of the system not understanding what interpreting, what translation is. So this special issue shows the whole spectrum of what is going wrong in society, why translation is not being wisely used by societies, and
That's
why
so important.
Yeah, exactly.
I really want you, if possible, to share the links so that we can send them out when we post the video, both for the journal and for the research, because things are finally, after a very long time, starting to shift. We all remember the days when the person who was given the responsibility for interpreter services at government level or in a hospital system spoke only one language and knew nothing about really interpreting or translating. It was just something that was added when back in prehistoric days, when I started interpreting, interpreter services in hospitals was always housed in the second sub basement next to the morgue, next to the engineering section where they make the prosthetic devices, in the leaky, dark, dungeony hallway. And I remember, oh, this is probably at least 15 years ago when I went to visit Carla Fogren at Stewart Medical. And her interpreting services was at the main entrance. There was reception and there was interpreting services right at the beginning. And when I walked in with her, I said, Carl, I think I'm going to cry. Because it's right where it should be. Instead of you have to win a prize in sort of a Dungeons and Dragons search to find interpreter services to go make that request. So more people who are leading translation and interpreting services for large organizations have more insight now than they used to. But I still completely agree that the world at large fundamentally doesn't get what's the difference between interpreting and translating. The doctors will call interpreters, get the translator in here. When we all know that interpreters is for spoken communication and translation is for documents, written communication. And if that very obvious difference is not perceived, everything that flows from that is also in that unknown area, in that limbo. And like you said about migrant populations or people whose primary language is something other than the environment that they're in, they're not going to ask questions about something they don't understand, even though those questions need to be asked. They didn't get the message to begin with. So that still is a huge problem we're suffering with. One of the things that I look at, even at hospitals, I used to work at Harborview Medical Center, which had at the time 50 or so staff interpreters and multiple language agencies they contracted with for languages of limited diffusion that we did not have on staff. And still there's a problem in the sense that you have a wonderful visit, you have everything interpreted, you're able to ask questions, but then you go home and there's a problem and you call. And what happens? The phone tree is all in English. You need to be able to understand to press 2 for this or 3 for that. And so that disconnect again, we offer great on-site, in-person or remote, and then we don't offer a way for people to get through when they call in for the 24-hour nurse line or to say, I didn't understand how to take my meds. There's still a lot of holes in our net, unfortunately. So thinking about that, thinking about the current times right now, what do you see as the biggest challenge or the biggest victory? It's wide open, but right now, what are your impressions? And Amy, start with you.
It's so funny or so interesting to hear Esther talk, because all of the things that she just discussed and Eliana, the things that you named are all sort of at the sort of a macro level, all really came up in our research and our interviews with both interpreters and with one of the teams in our group interviewed pediatric ICU providers, asking them about working and interpreting with interpreters and interpreted medical encounters. So all of those things came up. So from kind of interpersonal difficulties based on status, things like that, to intrapersonal challenges. So one of the things, for example, that the interpreters that we interviewed talked about, and I think this is a big challenge, are the microaggressions, are the implicit biases that come into the interpreted encounter that impact both the patients and families that are using the services and the interpreter. So that's a big challenge. Sort of, how does an interpreter, based on their codes of ethics in an encounter, balance not, trying to prevent harm being done, psychological harm being done for the patients and for the families, and accuracy, transparency, and completeness? Those are tough decisions to make when a provider says, why don't these people learn English? Which we all hear, right? Or, oh, these people have been here forever, how come they don't learn? So that continues to be a challenge. I think when I look at sort of challenges, I'll take it onto this sort of micro level in terms of the research we're doing in the specific children's hospital. I think one of the challenges that I see, but a huge opportunity, is doing what's called translational science. And you would think translational science is something that would be, up our alleys because of the word translational, but in medical research, what it means, or social sciences research, is translating the data and the conclusions from a study into, like Esther was saying, policy, into practices, into trainings on microaggressions, into something else that we found in our data was a major inhibitor of equitable language access are provider time constraints. Okay, how do you, here it is in the data, we all know that from experience, providers know it, interpreters know it, families feel it. What kind of intervention do we create, or policy or training do we create to address that problem in real life? I think that's the challenge, is that translating the data from the research and the conclusions from the research into practices, because there are all kinds of barriers in hospital systems, from budgets to time to winning over hearts and minds of administration and providers themselves. Asking interpreters to participate in these when they're already stretched thin. So I think in just speaking from this kind of micro research level, those are the challenges for our team. Okay, we have this great data. Now what? How do we make some change at like in real time at the practical level?
I totally agree. It's what you say is exactly what we believe. So from the journal, I'm speaking from the perspective of the journal. First, to foster that kind of research, the kind of socially meaningful research that can be translated into data. That's what we want to publish, but also to translate the research into policy and action, so that what we know and what we have found out, what the research has told us, has showed us, can inform our decisions at the policy level, and not our collective illusions, the cultural beliefs, the stereotypes, what we just believe it's true because everyone believes it's true, or we think everyone believes it's true. So we want first to foster research to challenge those stereotypes, those cultural beliefs, and then to provide ways for that research to reach the right people, those who are taking the decisions of how we share the resources within societies. We are trying to find ways to be translated into other languages, including sign languages, finding creative ways to reach a diversity of audiences, and involve a variety of stakeholders in the activities we organize. When we launch special issues, we want to engage specialists globally to become guest editors for highly specialized topics that are under-researched, and to engage practitioners, to work with academics, to conduct research in their workplaces, or to tell researchers what their concerns, what their real problems are. And we want them to publish with us, of course, and we want to test our authors' abilities to summarize the contribution, stressing the importance of a short paper title and a very clear abstract, so that anyone can at least have the minimum information from that research that can be used in discussions with their colleagues, with their friends, but also by policymakers, so that we can offer them quick ways to get the evidence they need to take decisions.
Because we need those metrics. I mean, we all know if you're going to have to restate everything, it's going to take twice as long. But yet we're still constrained to those 15-minute outpatient clinic appointments. And we also know that when the patient understands the directions that they're given at discharge, they will follow the directions correctly. They will adhere to their medication protocol. There will be reduced readmission rate. There will be less use of the emergency department as a point of primary care. Like there's so many things, length of stay in the hospital, all kinds of data that the people at the top track. But I am surprised by how few hospitals who engage in the Press Ganey patient satisfaction survey actually take the time to translate that survey into their top languages so that they can get feedback from the people who are most impacted by the existence of their interpreter services. I know a few hospitals that do that, but they all need to be doing that. So, right, if you have bad data, you're not going to make the best decision. You really need to see what's happening at my organization. And that means you have to include the people who don't speak the major language, English in the US, other languages in other countries, in order to see, am I serving all my patients equally well? What are the sticking points? Is there anything we can do about it that doesn't cost that much money? Because that's how a manager is going to think. But if you're not even collecting the data, how can you then create a response to it? So for that reason, I think it's really important that we share the journal. We need more people that aren't interpreters. I'm sorry, interpreters, this is not meant as a slight, but we need more physicians and clinic managers and people that run the emergency department to weigh in on these issues and publish so that we can then take some of that white paper evidence to the C-suite when they have their meetings and make our presentation in a way in their language, right? They don't want the anecdotal story of how wonderful the interpreter was, or they'll save that for the awards dinner, but not for the decision-making when it comes time to allocating money for budgets or making a big decision like extending person who needs language assistance time, which it's right there on Epic in the US. If they need an interpreter, it's visible to the person making the appointment. There should be a little bit of a buffer added to the time so that we can complete and that patient is allowed to ask all of their questions. So how do we get that to happen? Part of the reason we're doing this podcast is to be able to share where people have moved the needle at the grassroots level. How do I get involved? Who do I talk to? How do I get laws passed in my community, in my state? Because although the US is huge and we do have federal mandates like Title VI, it's basically toothless, right? Because there's no big financial penalty like for Americans with Disabilities Act. So how do we enact changes locally is part of why I'm trying to rope in as many divergent opinions in the world of language access to talk about what they've done that works. And what you did, Amy, with your study, bringing in a variety of stakeholders to participate and witness just how pivotal a human interpreter can be in terms of building the trust and getting the communication, getting questions answered without wasting time, which most patients don't have, especially if they're seriously ill. And a journal like yours, Esther, for people to publish so that we can point to reliable resources when we're making our arguments. So please make sure and share that with us. And just as a quick reminder, we've already hit 35 minutes, but I do want to ask our last question. So keeping that in mind, if you can be succinct, looking forward, what do you see as the biggest thing you're going to tackle, the biggest challenge, the biggest success that you're going to ride that wave right into the beach? Looking forward, what do you see coming, other than artificial intelligence and chat GPT that may impact our world of language access?
Yeah, I think you said it earlier, Eliana. I think if I look at kind of a micro level, at a certain hospital research in a certain place, a certain snapshot of this place, the thing that I think is going to really impact perceptions of language access and equity issues around language access is getting the family, the patient, the user perspective in multilingual research. And there are barriers to doing multilingual research. So, for example, in our team, we've interviewed interpreters, we've interviewed providers, not broadly, but at small groups. But we don't have that family in the peds environment. We don't have that family perspective because there are systemic challenges to doing multilingual research that have to do with paying for translations and back translations in order to get internal review of IRB approvals to even do the project. So there are roadblocks to it. And English only as a participant requirement is an exclusionary criteria that, as you said earlier, limits the data that we have on language access. We just don't have the data from the users who speak diverse languages. So in my mind, working on easing some of the barriers or breaking them down to multilingual research and doing more research across languages and cultures is going to hopefully move the needle, because what we'll be looking at is health communication equity. So that's, kind of where I think we're headed, hoping to make some progress in that area.
I totally agree. It's what you both just said is challenging boundaries. What you're doing with your work, you both doing with your work, challenging boundaries. And we all working. There are a lot of people working for the common good, and to allow every community to thrive. A lot of people who care, and more specifically, we are allowing people across areas, across geographical boundaries, to note what translation can and cannot do. Because you need to stop service providers who believe hiring a translator or an interpreter means that they have done everything there's to do to meet the demands of multicultural and multilingual communities. We want to engage them because there are a lot of us working, and we need to have some platform to meet, to work together to produce knowledge and management of diversity, because each and every one of us needs to play a part. And I think the journal, the people behind the journal, the authors, all the researchers that we want to reach to, we know how to live across communities. And that includes academic communities, but also stakeholders. We are involving policymakers. And when we first presented the first special issue on language policies for social justice, we had members of the regional government attending, high school teachers, doctors, translators. Most contributions were authored by translation scholars, but the location of our presentation was a law school. We need to keep challenging boundaries. We need to engage other people because we know what translation is, and we need to ensure that others have the chance to really understand what translation is.
That's it in a nutshell, I think. And I wish we could stay on and chat longer. And thank you, Amy and Esther, for joining us today. Really important ammunition that you have to share with all of us to be able to go and use when we make our pitches, whether it's in the elevator or in the C-suite, to the people who have the power to allocate budgets and make policy changes within the systems that we're working in. Remember, everybody, we can all do something. So we'll be posting the journal title and way to access and your research, Amy, because take a peek, see if there's something that you can pull from that and implement in your local world, because it's all of us pulling together that have gotten us to where we are from where we started. And yes, there's still a long way to go, but I think we should be proud of the changes that I've just seen within one short career span, to the point where we now have national certifications and the push towards longer training and education for interpreters, again, to shift the perception of the interpreter as an app or a tool, and the interpreter as a professional member of the healthcare team. Join us next month for our next podcast, everyone.